have to actually use those 10-15 products before hitting bed in the night, because they are promoting Korean skin and glass skin, and you have to follow this regime of 10 cleansing things and all that. What is your idea?
All this glass skin thing came from Korea. So basically, you know Korean skin, right? So they normally have oily skin. The skin is really oily, but of course the zits and all that, they naturally don't have that many skin issues because the skin is naturally like that. Skin is naturally plain and smoother, glowing, and all that. Our Indian skin is different. Even this glass skin formula will not work. Okay, so if you have a plainer skin, smoother skin, you try to use a good moisturizing product. That is glass skin. Good hydrated skin is glass skin.
So Korean people have natural skin tone. It's environment also they live in. It's also the diet they are taking
Yeah,
care. The diet is completely different from people
yes.
taking it in Korea. Indian weather is, changing every 3 months, 4 months, and maybe it doesn't happen there in Korea. So we should not just, as you said, jump into things. Anything which is hydrated and taken care of is glowing and is a glass skin, right? So, welcome, Dr. Nithya, and very good morning. And thank you so much for taking out time for us. And Dr. Nithya is a senior consultant dermatologist and cosmetologist. So, we want to hear from you. Like, how are you experiencing the teenage anxiousness on how do they look, how do they body weights, and how is it going with you? Can you share some experiences with us?
Hello, good morning. I'm happy to be here.
Thank you.
So I see a lot of teenagers these days and parents coming with teenagers, much younger children, and they express their anxiety and they spend longer hours with us. And, partially apart from treating their issues, we are also, psychologists, so there is an entity called psychodermatology,
Yeah.
so wherein most of the times dermatological issues are purely related to psychological issues rather than the main dermatological entity. So
So,
it's highly increasing these days.
so at what
And
age did children start coming to you with parents?
I start seeing from the age group 3 4 itself. There are a lot of studies also about it, and the kids as old as 3 4, they're so conscious about coming to just clinic. They carry nice fancy bags. They try to deck up themselves with makeup. They use their mom's makeup, uh, which is generally not safe. I mean, we have to set standards for them. Parents doing it, they idealize them and they idealize the, celebrities.
Yeah.
This is how it's influencing the kids.
Okay. So at what age parents come with their children for consultancy to change the skin color or to change the weight? At what age do you have patients from or clients from?
So, like skin tone bias is increasing these days, and I get parents who are darker skin types already, and they already have the feeling of inadequacy, and they pass on to their children. And they have two children. One child may be lighter skin tone, and the other child is darker. So there's more pressure on the darker skin tone child. They try to equate fairness with beauty,
Okay.
and they keep that as the beauty standard,
Okay.
which is actually affecting their overall mental health. And there are a lot of stress induced skin conditions,
Yeah.
okay, due to that. So
Do you think that it is parents who's creating that pressure on children for their darker skin tone or with the way they look? Or is it children who's getting it from social media or another set of environment?
there are multiple factors. So, firstly, it can start off from the family itself, right from the parents and the relatives. So
Yeah.
I had one of my friend, she always used to feel bad because she was dark skin tone and people started calling her Blackie. So, like, she was so concerned about it, and I grew up with her, and I can still see that she's passing on to her children as well. This kind of self-image, it can cause a lot of mental health issues.
So, what do you think one message to children with anxiety or parents who are carrying that anxiety from their childhood? Like, how can they meet a balance? What is your one message to them?
See, basically, we have to emphasize on inner qualities, their personality traits, like their talents, creativity, kindness, empathy. So, we have to inculcate these habits into them, and we have to appreciate those
Yeah,
rather than focusing on physical appearance.
yeah.
So, that's
And
more
then
important.
I think I am also a mother of two boys. One is toddler and one is teen. Recently, when my elder one started gaining weight, because there were exams, so he got very conscious. Like I'm gaining weight, and I'm sitting all the time and studying and not moving around. He's a player, athlete. He plays basketball. But I think there
Yeah.
is one, as a mother, as a psychologist, I told him one thing. I said one thing at a time. Right now, you are studying and you need carbs. Your body needs energy to concentrate and focus. So focus on that thing. Once you
Yes.
are over with your exams, things will be back. Then go to your sports, get that thing done. But never be too harsh on your body. Nothing
Yes.
happens like at a snap of a time or
Yeah.
something. Go slow about it. Anything which is happening unnaturally and very, very fast, it is going to harm your body and mind both. Okay. So recently, Dr. Nithya, we read about this very sad news. There's this 18-year-old girl. She died because she was on water diet for 6 months in Kerala. So, what do you think? Like, what is the role of parents in telling the children if a child is pursuing any diet, following a social media criteria? How do a parent play a role in it? Why are they not able to keep a check what the child is doing, or why are they not able to counsel, like go to professional and get it slow? You want to lose weight, fine, go to a professional, get it done. You want to change your skin tone color, maybe, Janvi Kapoor also talked about it, that I had insecurity, I had got my teeth done, my skin done, my whatever. She has mentioned a lot of things, and there are a lot of celebrities who are getting open about it, like we go for cosmetic surgeries. Now this is also somewhere influencing teens, like if they can do it, we can do it too.
Yes.
But what is your advice, like, rather than following the social media things, or how the children can be motivated to go to professional and talk this about to their parents?
So basically, the celebrities and they try to endorse some brands, and they're trying to advertise those brands.
Yeah,
So basically, the children or teenagers looking at it, they believe that they are actually using the products, which
yeah,
is not true.
which is not.
And they set unrealistic expectations to them. And no, I get some patients, no matter what we do, they're really not happy. They I try to give products, or simple products to start with, and they're still not happy. We try to do products, still they always have this fear, that they're not looking good, and the body dissatisfaction, what we call it. All of us to work have to work together,
Yeah,
you know like including society, parents, teachers. There should be PTMs held at schools,
yeah,
counseling the kids about what is true, the social media influencers influencing certain brands, or cosmetic products. So we have to work on it. Of course, the doctors, as dermatologists, I get a lot of patients, teenagers especially, with acne and hair loss. Okay, all this can happen because of stress and sleeplessness, because of studies, or sometimes the diet changes, sudden drastic diet change, like you have told now. So water diet, they're so influenced that they just want to lose weight, and they want to get that result within short period of time,
Yes.
which can have a greater impact. So I'm seeing kids with balding and sudden eruptions of acne, causing a lot of inflammation and scarring. The scarring can also have greater impact in future. So you have to address those things early, but keep your skin routine simple. Don't go on trying too many different things. And even eczemas can flare up because of this.
Talking
Um,
about baldness, I see a lot of girls nowadays have started losing hair,
mm,
at a very, very early age. And there are brands coming up, a very famous brand that provide wigs, extensions,
yes,
and it is like massive growth in the hair product industry. And
yes,
these wigs and extensions are not one, they are not very, very very, very safe because it's stopping the oxygen and circulation of air getting through your scalp to your body
yes,
because it is covering your head forever. And then number two, it's not cheap. It's very expensive, 15,000, 20,000 for a wig or for an extension. So rather than
yeah.
investing there 15, 20,000, do you think it's feasible that you get to a consultant, to get to a doctor and have your things done, like your vitals right? Few vital tests that you recommend that every person, every teen should go through if they are experiencing any changes in their body. What are the top tests that you recommend?
Management of any condition should start from lifestyle changes like timely food, good sleep, consistent sleep, and a healthy diet, non-inflammatory diet. Then comes, the medications according the basic multivitamins. Then rule out all the other conditions which could be triggering like fever or sudden weight loss. These things can also cause hair loss. So once all these are ruled out, and then we if it's still not improving, then we jump into investigations. Because teenagers don't need too many investigations. Generally, most of the parameters are fine, but still, the basic test, if you want me to recommend, I would say vitamin D and thyroid levels,
Okay.
okay, B12, okay, and hemoglobin. So the basic test I would recommend for anybody, I would say, would be hemoglobin,
Yeah.
okay, thyroid profile,
Yeah.
vitamin D,
Okay.
B12.
Okay.
So these are the common things that generally I would recommend. But apart from that, we need to rule out and assess the patient and accordingly. I would
Yeah.
recommend.
So talking about tests and hemoglobin, Dr. Nithya, I read somewhere as a research that 57% of women experience hemoglobin issues and 67% of children between 6 to 59 years experience hemoglobin issues. Do you think
Yes.
hemoglobin plays a very important and primitive role for your skin, for your hair loss, and other body things, body issues like?
Yes. See, basically, hemoglobin needs iron, and so iron is the main mineral which is deficient in most of us, and especially in women and adolescent girls, because of menstrual cycles and different factors, they try to lose lot of blood, due to which iron deficiency is common. And this mineral especially is necessary for many of the body reactions, and it is essential for hair growth, for good skin, and sometimes you also feel weak and giddiness, back pains. All this could be because of iron deficiency.
And since you are a dermatologist, a cosmetologist yourself, we would like to have few questions for you. So, what is your go-to routine? Like, what do you do on daily basis to keep to take care of your skin?
Basically, I get this question a lot of times. What do you do, doctor? And can I use the same? All these things, especially from teenagers and mothers. But see, the thing is, every skin type is different, and so based on your skin type, what suits you best, you need to use the products. Like for say example, you have very dry skin, and I cannot give products which are very light, like like say moisturizer, or I cannot give exfoliating face washes. So accordingly, the skincare routine will change. For example, I have normal skin, normal to dry skin, so I keep a simple gentle cleanser, and then I use I play with moisturizers based on the weather change. Then a sunscreen. So these three things are very important for my daily routine. So I keep it simple, but once in a while, like once in a week or twice a week, I use retinol. Okay, but this same routine may not apply for everyone. So that is very important.
Yeah, that's very important point actually, that things that you're working out for you may not work out for me, because we
Yes,
all are
yes,
different and we all have different skin tones. So before we just jump into anything because of the social media, I see a lot of products. If you are not using this cream, if you are missing out something like that's complete disaster. Please go to a professional like you and maybe consult more online and then get your things done rather than just following those influencers on social media and just going for that glass skin, that's a trend these days,
yes,
glass saying.
yes.
So what do you think this, do you have to actually use those 10 products, 10, 15 products before hitting a bed in the night, because they are promoting Korean skin and glass skin, and you have to follow this regime of 10 cleansing things and all that. What is your idea on it? Are we actually supposed to use those 10, 15 products, or it's just the normal cleanser, toner, and moisturizing that the way we were using?
So the thing is, all this glass skin thing came from Korea. Hmm. So basically, Korean skin, right? So they normally have oily skin. The skin is really oily, but of course, the zits and all that, they naturally don't have that many skin issues. Because the skin is naturally like that, you tend to have that because of their ethnicity. The skin is naturally plain and smoother, glowing, and all that. And the products accordingly also would vary. But our Indian skin is different. We have combinations of skin. We have different tones, different ethnicity. So because of that, for everyone, this glass skin formula will not work. Hmm. Okay, so if you have a plainer skin, smoother skin, you try to use a good moisturizing product. That is glass skin. Good hydrated skin is glass skin. That's all. It starts
Hydration.
reflect.
Yeah.
Yeah, good hydration. That is the main factor. Okay, so rest all are just hyped up. It may not apply to all of us, and you can also see some people who have oily skin. That's like glass skin. That's all. There's nothing fancy about it.
Mhm.
Yeah,
So Korean people have natural skin tone. It's environment also they live in. It's also the diet they are taking
yeah,
care. Diet is completely different from people
yes,
take it in Korea. Indian weather is, changing every 3 months, 4 months, and it maybe it doesn't happen there in Korea. So we should not just, as you said, jump into things. Anything which is hydrated and taken care of is glowing and is a glass skin, right? So thank you so much for sharing
and
that.
I would like to add one more point here. So you were saying that people are already naturally using 10 different products. Yeah, of course, because of this social media platforms like TikTok and Instagram, they get so influenced that already when patients come to me, they're literally using 10 different products, and that's really not nice. Just because the product is there in the market, you don't really have to use that ingredient, right? So you can keep it simple in your routine. So you have an oily skin, try to use products which will control the oil secretion, like salicylic acid, wash or the serum, or niacinamide serum. And if you have dry skin, try to include hydrating products. And snail mucin is something which is also hyped up, and I see a lot of teenagers coming with acne eruptions because of snail mucin, because that's one thing which is promoted to give glass skin. And the teenagers end up using it and they come to me with acne prone skin. So that's why you should be very cautious when you're trying to use these products.
Okay.
Yeah.
Dr. Nithya, I really want to know nowadays, a lot of celebrities hitting back work within 40 days, 3 months, and losing all those belly fat, after delivering the baby. Is it setting wrong standards for body recovery? Do you also get such clients wherein they just want to get rid of their belly fat and their arm fat and, just want to get into a shape for the way they look and want to gain back that confidence? Do you also get such kind of clients?
Yeah, yeah, of course. The thing is, celebrities already they are in a good routine. They work out
During pregnancy.
prior to pregnancy.
Yes.
Yeah, and then post delivery, they try to maintain the same. So that is one scenario. But for some, it may just be surrogacy. They would have really not undergone the pregnancy.
Okay.
They might have fakely, portrayed, huh? Okay. So all this will also be, you should not just get wrongly influenced by them. You need to wait after delivery, wait for a while, let things settle down. Mentally also you're exhausted, sleepless nights with a baby. Wait for a year or so, then gradually, start working on your diet, work out, and take it slow. Don't hurry in such things. You don't gain anything by doing those things. And then because of this drastic weight loss, you may also experience hair loss issues. Again, that can become a stress, and it's like a cycle. One can lead to another issue,
That's fine.
and ultimately,
Yeah.
yeah, yeah, take your time and then take it slowly. And so basically, you have to focus on fitness here and managing time post delivery. I'm sure even you must be knowing. Like we as working mothers, we have to balance everything. So
I
it's
took good
it,
I took good 7-8 months before hitting back to work again, and then
yes,
I
yes,
also cut down it to half days. I did not go full day because I was focused on one thing. I think the way I look, I don't diet, I don't do much of exercise. What I do is I follow home food, and I avoid junk even in parties, and I
yeah,
try to stay
understood.
natural to the extent I can. And I believe in slow progress. So I think
Yes,
that's
yes,
that's the one thing, because even after becoming a mother, you don't want to gain a lot of weight. So I think stop your sugar cravings. That's must thing. So that's
yes, yes.
there, but you have to manage that on a diet basis. And Dr. Nithya, one any advice that you wish like to share with all our audience and mothers specifically who are teenager exposed to so much information and social media thing that the way you should look in a certain way, your skin tone should be in a certain way, and one tip for parents and mothers how to control that anxiety and what role they can play.
So I feel all of us it should start from the roots, and we should emphasize more on the inner qualities of a person rather than focusing on physical appearance. And community awareness and social media awareness, all of this should spread the news that whatever we are seeing is not true, and we should all have realistic expectations and keep the routine simple. Okay, and this will eventually dismantle the harmful stereotypes that we have in our society,
Yeah.
and eventually this will foster more equitable society.
Yeah.
So that's what I would
And
like
thank you
to.
so much, Dr. Nithya, for spending out time with us. And I'm sure a lot of teenagers and mothers will be getting good thoughts and approved, validated knowledge from you. And I
Yeah.
request all the mothers and
Hope so.
parents, yeah, I'm sure. So I request all the mothers, parents to please be in lot of talking terms with your children, communicate more. And if the social media and the environment is pressurizing them for to the way they look or the way they're presenting your body or their skin tone, please talk to them. And even if you want professional help, go to a professional and just let your children save your children from this fake information that's floating everywhere on social media environment. And just do not use too many products on your skin, because that's also very, very harmful. Yeah.
Yeah.
Thank you so much. Wish you a very great day ahead. And thank you so much for taking your time. Yeah. So I'm
Happy to be
really
here. Thank you so much. Hope it helps the society. Whatever discussions we have made, hope it helps
definitely.
everyone.
Hello, parents. If you find our podcast relatable, educational, then do subscribe to our channel. In the comment box, write your parenting challenges. We'll try to address them one by one. And never forget to share it with amazing parents like you. Because remember, by learning together, we can raise kind, confident, and connected children for happy families and happy nations.